The story of Viagra is on BBC Two tonight at 9 p.m. Dr. Jeff Foster, GP. Good morning, Doctor.
Morning.
Jeff, what's the physiology of it? How does it work? Why does it work?
Viagra works by dilating arteries. It's a really simple drug. When it first came out, obviously they were trying to control blood pressure, the idea being that if you dilate the arteries in your body, you reduce the pressure. So great, except it wasn't very good at doing that. Obviously the side effect, which wasn't intentional at the time, was it dilated the penile artery, and that had a massive benefit for the people it used. I think the big thing about it was that prior to this, there wasn't really anything out there. So if you had erectile dysfunction, you were really pretty stuck. So for all these guys, this was suddenly a game changer because you could get an erection when you wanted.
The penile artery. Funny enough, I've got a little dog, West Highland Terrier 13, and she has a life-limiting... You're probably wondering how I'm saying this, but she's got a life-limiting...
Yeah.
It's weird. Well, bear with me. She's got a life-limiting condition called Westy lung, and the vet put her on Viagra. It's a pulmonary condition, and it seems to give her relief. So, as you say, all sorts of other benefits, but this was an unintended consequence, Jeff.
Yeah, we do actually use a similar drug to Viagra, a sort of newer, more advanced version in people with pulmonary hypertension, even children. And children get doses.
Hence the vets thing.
Totally agree. 10 times a dose that we give in younger people. But it does have that other beneficial effect in adults, of course. And I think the big thing to always think about, and I won't drag on at this, but the penile artery is very, very similar to the arteries that line your heart. So the coronary arteries and they're kind of the lining of them, the endothelial lining, are really similar. So we always say if you've got a problem with the artery down below, then you've got about a 3-year window before the problem up above also kicks in. So everything is all linked.
Does it carry on, the erection, after you've finished?
No. And this is the big thing about Viagra. There's this kind of misnomer that if you start taking Viagra, you're going to be some sort of sex-crazed lunatic. But actually,
it's not an aphrodisiac. That's the point.
It's not.
People don't get that. Yeah.
There was some recent articles about the 25-year Viagra celebrations, and bizarrely, there are these some people writing this how they felt that taking Viagra, it was written from a partner's perspective, not the person taking it, saying that since they'd taken Viagra, they'd become these sort of sex-crazed lunatics. But of course, honestly, this is nothing to do with libido. If you don't want to have sex, Viagra does nothing. All it does is improve the blood flow and nothing else.
And the confidence, because the blood flow is improved and you're getting the erection, it improves your confidence, perhaps.
Yeah. I mean, a lot of younger people, or a lot of people who have taken Viagra a few times, just like to have it as an on-the-shelf thing. They know it's there if they need it, but they don't always need the stuff, and that reassurance is massive.
Do you find men do find it a difficult subject to broach when they're in the surgery with you?
Oh, God, yeah. So the normal time for a guy to suffer with erectile dysfunction before he comes to see me is around 3 years. And That's a hell of a long time to suffer with a medical condition. I think the problem is society, there's a bit of a stigma behind it. It's embarrassing. You're not a guy if you can't, you don't go to the pub with your mates and go, right, who wants to talk about their flaccid penis? Because no one. That's how you lose friends pretty quickly. But you also don't want to go to the doctors because a lot of doctors don't feel comfortable talking about Viagra. They don't know what to do. So they often just hand out a bit of Viagra, here's your ED treatment, off you go, and then you're done. It's kind of the last thing you talk about because it's all a bit awkward. And the problem is now you can buy this stuff over the counter, you can buy it online. Well, that's making risks even worse. So if you've got, like I said, it's related to your coronary artery. If we think the common cause, or one of the common causes, is either hormonal, so dropping your testosterone, or it's due to narrowing of the artery. Well, if the narrowing artery is occurring in the penis, the narrowing of the artery is occurring in the heart as well. And we say you've got around a 3-year window from the onset of things happening down below to some form of cardiac event like heart attack or stroke. So if you can buy this stuff over the counter, or you're too embarrassed to go to the doctor or anything, you're delaying that time that we could have got involved and treated you properly.
What a great point.
I think the reassurance, as the doctor said earlier, the fact that it's there as an amulet almost for men to feel that they don't need to worry so much about their performance, because we are judged, and unfortunately we can tell a man's sexual arousal rather more obviously than we can with a lady.
Jeff, come back in here.
I agree with all the points above. I'd say maybe about a third of our patients come in because the female partner or male partner, whichever, but it's the partner that's the person that pushed them to come and speak to us. A lot of guys are kind of like, really don't really want to have to come, and it's all very, very awkward. I think there's the stigma issue, and the attitude towards erectile dysfunction delays treatment in a lot of guys, and it's that delay that I keep harking on about that's so important. Because if you don't know why you've got it, so Viagra treats a symptom, it doesn't treat the cause. So why have you got erectile dysfunction? Is it because your testosterone's low? Is it because you're narrowing your arteries? Is it because you've got an anxiety or stress disorder that means you just can't achieve a decent erection? But until you know, all we're doing is really just giving you a drug to buy you a bit of time. And the more we trivialize it and make a joke of it, and or worse, just accept the fact that maybe
Can I also
50,
point out
60
embarrassment as one of those?
Yeah, completely agree. God, it's a really personal
It's not
thing.
all medical.
I think you're right. I think from a guy's perspective, it's an incredibly personal thing, and it can be really hard to feel confident enough to open up about something that society deems as a very personal and inward thing to talk about.
Yeah, I think the emphasis on the medical and the fact that it's a precursor of something terribly dangerous doesn't address the fact that many men are extremely embarrassed to perform in public. I'm not one myself, but a lot of people are. And so the bedroom can be a very scary place for a lot of men. That is not medical, that's psychological.
Yeah.
Well, I mean, it could be both, really.
I
Doesn't have to be one or the other.
The psychological one can lead to the other, yeah.
Well, we do certainly see, for example, younger men. So I know when I'm saying younger now, because obviously I'm in my 40s now, but younger men in their 30s or less, they tend to have a more psychological cause of their erectile dysfunction. But you can't dissociate the two. And I would argue that a guy who's his 50s or 60s, if he has got a biological cause and he's got diabetes or whatever thing, and it's making it harder to gain an erection, it's never going to be just the fact he's got diabetes. Because once you've had erectile dysfunction once, you've always got that thing in your head that says, oh my God, what if I can't perform this time? What if it's not going to be there? And then there's that impact on the partner. And the partner's going to say, well, maybe he doesn't love me as much because he can't get an erection as much as he used to. And
Absolutely.
it breeds this negative cycle. We see loads of guys who've basically just said, to be honest, we don't even try anymore because I don't want to risk the embarrassment or the shame that I can't perform when I need to.
Yes, and that's not to do with their incipient heart disease.
No, exactly. Yeah, it all feeds around. I don't think you can ever dissociate one from the other. And we have to accept that if you treat erectile dysfunction properly, you have to think about how it affects the person as a whole, not just the penile artery or whatever else you're doing with it.
The number of prescriptions for Viagra, other brands are available, other erectile dysfunction drugs, has nearly tripled in the last decade because they become cheaper, they carry less stigma, but they still do carry stigma. But the Royal College of General Practitioners, they put the increase down to growing awareness, as I say, it becoming cheaper, diminishing stigma, and also more men feeling comfortable enough to visit their doctor and talk about it. Is it better now, doctor, than it used to be?
I'd say we're way off where it needs to be. I would just go back to that last point where you said about how a large number of people are coming in with a non-narrowing of artery cause, and that isn't what the statistics actually show. 90% of men over the age of 40 have some form of at least one physical cause that can cause their erectile dysfunction. That doesn't mean I don't mean that there's no psychological additional effect of that, but 90% will have some form of biological cause that goes with it. So I think it's really important not to say that, just to get our notice saying, well, this is probably a psychological reason for this, and it's really important that we do look at the reasons why.
And the quality of the erection is important as well, isn't it?
Yeah, so the idea of erectile dysfunction shouldn't be just, can I perform penetrative sex to achieve an orgasm? And the definition of erectile dysfunction really should be more along the lines of you can achieve an erection to perform a satisfactory sexual process for you. And a lot of guys will say that over time, their erections are just not quite as good as they used to be. So, I'm not suggesting it should be like when you're 15 and like the wind changes, you get an erection. It shouldn't be like that. But it's just that the quality of the erection starts to go down over time. And for most blokes, it's really gradual. And to the point where just you think, hang on a minute, I can't achieve that erection as I used to. and you realise it's been insidious over many months or years.
Yeah, the teenage years, the days of the involuntary erection. Andrew in Blackpool. Hello, Andrew.
Good morning, Nicky.
I'm going to read a text first off. Viagra changed my life, aged 50. Prior to that, every relationship ended, probably through lack of confidence on my part. Viagra changed that. Now I'm 10 years into a stable relationship and I have never been happier. Thank you so much to the people who developed it. There we are.
What's really important. But obviously, if you're in relationship, or even if you're not in relationship, ability to get an erection and an orgasm is still, really important. So I think there are a lot of men out there. I don't think that's been touched on unless I've missed that so far.
Jeff Foster, do you want to pick up on that point, Doctor?
It's a really, really good point to highlight. So we have about 1,000 patients in our H3 private clinic, and I would say that a significant proportion have been given antidepressants at some point in the past, either for example, they thought it was low testosterone, so they must give them antidepressants because that's why they're sad. But actually the side effect of this is that it then induces or worsens erectile dysfunction. So if you're somebody that's got depression and you're feeling low, you don't often feel like you want to have sex. So you go to the doctor gives you an antidepressant, and of course it makes you feel a bit better, but then actually you find that the sexual function is even worse. And so you're making one problem effectively even worse than it was to start with, and just creating this negative cycle around medication and attitudes towards ED. It's so common that in general, the first thing we tend to do is say, well, what medicines are you taking? And that you see the antidepressant, you go, oh, well, that might do it. So you've got to think, how do you get around that?
And a couple of texts. I started experiencing erectile dysfunction after being on antidepressants. It's a well-known side effect. Using Viagra, other brands are available. Really helped me to have a full sex life. And thank you to Joe Hemmings and Brian and Emma, and that was quite a call from Emma and her husband, and Dr. Jeff Foster, and everybody else. Have a good weekend.
The voice of the UK. This is BBC Radio 5 Live.